So for the first part of the dental scaling, I'm going to take my my probe and I'm going to feel on each tooth for any irregularities. And while I'm doing that, I'm also removing some of the plaque and soft tartar that's on the tooth as well. And you can use this up around the gum line. And the second part of the probe, which is this end, which I talked about earlier, is also used for checking for deep pockets. So I would insert this gently up around the tooth, checking for any millimeter pockets or significant pocketing around each tooth. Nope. Perfect right there. Yep. So the second part, after I've done some probing, I want to take the sickle scaler and I want to make sure that the cutting edge is 1/3 in contact with that tooth at all times. And I'm going to hand scale around the tooth, around the surface area of the tooth, on the outside and on the inside of the tooth. After I've scaled each tooth on the outside, on the inside, and front and back, I want to make sure that I rinse this area well, and then I'm going to wipe it dry with some gauze or paper towel, and I'm going to apply a fluoride foam to that area. I'll pat that in, and I want that to sit on the teeth for about 5 minutes. So a couple things about the fluoride foam. It's very acidic, so you want to make sure that you're doing this to patients who have an endotracheal tube placed or under anesthesia, because you don't want them to swallow this or aspirate it. It can cause irritation. The other thing is you want to make sure that you leave it on in contact for 5 minutes. And then when it's time to come off, you're going to wipe it off and not rinse. That leaves the protective coating on the tooth. And you want to make sure that you get all of that wiped off from their mouth.